Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started with CPT code summaries, thoracic spine X-rays. CPT code 72070, radiologic examination, spine, thoracic, 2 views. This code is used when the radiology report documents exactly 2 views of the thoracic spine mid-back. CPT code 72072, radiologic examination, spine, thoracic, 3 views. This code applies when 3 views of the thoracic spine are taken. CPT code 72074, radiologic examination, spine, thoracic, minimum of 4 views. Use this code when 4 or more views are taken of the thoracic spine. These views are used to evaluate the thoracic spine, T1 through T12, and adjacent structures. The number and type of views directly affect CPT code selection. Thoracic spine, antero-posterior projection of the mid-back. Thoracic spine lateral view, side view of the thoracic spine. Cervicothoracic region lateral swimmer's view, Twining method, is a special lateral view to visualize the lower cervical and upper thoracic vertebrae. This view is used when standard lateral view does not clearly show T1, T2, and T3 due to shoulder overlap. Thoracic spine AP or PA oblique upright view, oblique projection, upright position. Report overview, order exam, T-spine, 2 views, header, upright frontal and lateral views of the thoracic spine, history, injury. The patient fell at school, and 2 additional students fell on top of them. Pain is localized to the superior to mid portion of the back. Comparison, none available. Radiology report summary, upright frontal and lateral views were performed. No thoracic spine fracture or malalignment was identified. C7 through T2 was partially obscured on the lateral view due to overlying structures. No significant findings were noted in the partially imaged chest. 11 pairs of ribs seen. No free air under the diaphragm. Impression, no thoracic spine fracture detected. No malalignment. The correct CPT code is 72070, radiologic examination, spine, thoracic, 2 views. This matches the documented views frontal, AP, and lateral. Although the lateral view was limited at C7T2, it still counts as a distinct view. Let's choose the appropriate diagnosis code based on the clinical history and findings. The patient presented after a fall at school with upper and mid-back pain. The radiologist ruled out fracture or malalignment. Since there's no confirmed injury but pain is present, and the visit is for evaluation after trauma, the best ICD-10 code is Z04.3. Encounter for examination and observation following other accident. This code is ideal when the patient presents after an accident or fall and imaging is done to rule out injury with no confirmed traumatic diagnosis in the report. The correct codes for this report are CPT code 72070 thoracic spine 2 views and ICD-10 CM-Z04.3 observation following accident. Report overview, order exam, T-spine 3 views, header, AP, lateral, and lateral swimmer's views of the thoracic spine. Clinical history, trend compression fractures, comparison radiographs 9/23/2022, MRI 5/5/2022, findings, subjective demineralization, redemonstration of multifocal thoracic compression fractures most pronounced at the T8 and T9 levels. Height loss is not definitively increased from the prior exam. Unchanged mild kyphotic deformity at the mid to lower thoracic spine. Gastrostomy tube present. Impression, multifocal thoracic fractures without worsening height loss. Now let's identify the correct diagnosis code. The radiology report confirms multifocal thoracic compression fractures with no new height loss, and this is a follow-up outpatient study. However, compression fractures can either be from trauma, acute, or they can be caused by osteoporosis, a chronic condition. As a coder, this is when you need to check the chart to see if the compression fracture is acute or chronic. If the compression fracture is chronic, the most appropriate ICD-10 CM diagnosis code is M48.58XD, collapsed vertebra not elsewhere classified, thoracic region, subsequent encounter. If the compression fracture is from trauma, the most appropriate ICD-10 CM codes are S. 22.060D, wedge compression fracture of T7, T8 vertebra, subsequent encounter for fracture with routine healing. S22.070D, wedge compression fracture of T9-9-T10 vertebra, subsequent encounter for fracture with routine healing. Because the patient is being monitored for previously identified fractures and no new injury is indicated, the D extension correctly reflects a follow-up encounter in both acute and chronic conditions. Report overview, order exam, T-spine 4 or more views. Header, AP, lateral neutral, lateral flexion, and lateral extension standing views of the thoracic spine. Clinical history, 48-year-old female with a history of Parkinson's disease and movement disorder program. History of thoracic spine surgery 1 year ago for treatment of thoracic disc disease. Comparison, thoracolumbar radiographs 10/19/2022, 6/27/2022. Findings, partially visualized thoracolumbar posterior spinal fusion with T12 corpectomy and bilateral posterior rods at the T10L2 levels without evidence of hardware complications. No evidence of significant dynamic spondylolisthesis or vertebral body height loss, although demineralization limits complete evaluation. Upper abdominal surgical clips. Visualized lung fields are unremarkable. Impression, partially visualized thoracolumbar posterior spinal fusion T10-L2 with T12 corpectomy without evidence of dynamic spondylolisthesis or hardware complication, noting osseous demineralization limits complete evaluation. Let's look at the views. AP, lateral neutral, lateral flexion, and lateral extension standing views of the thoracic spine. That's a total of 4 views. This qualifies for CPT code 72074, radiologic examination spine, thoracic, minimum of 4 views. Now let's review the proper ICD-10 diagnosis coding. The patient is undergoing postoperative evaluation following treatment for thoracic disc disease. Imaging confirms a prior posterior spinal fusion with T12 corpectomy. Since no new pathology is identified in the current report, and the study is focused on assessing the status of the spinal fusion, the most appropriate primary diagnosis code is M43.24, fusion of spine, thoracic region. This code reflects the purpose of the exam and the medical necessity to order non-standard spine views such as flexion and extension. These views are ordered specifically to evaluate how the spine is interacting with a known spinal arthrodesis. To indicate the presence of spinal instrumentation, a secondary code should also be reported, Z98.1, arthrodesis status. This accurately captures the presence of implanted spinal hardware without implying complications. Thanks for watching. Be sure to check the links in the description for helpful resources and subscribe for more radiology coding content.